So good afternoon. Today we'd like to discuss housing and ways in which our administration has worked to provide relief to renters and homeowners. But first, I want to give an update on testing and hospitalizations. Yesterday, the state reported that over 10,000 new individuals were tested for COVID-19. Overall, about 1.25 million tests have been administered to date in Massachusetts. Yesterday, there were 142 new positive cases reported, and that brings the statewide total to about 106,000. The 7-day average for the positive test rate remained at about 1.7%, and that positive test rate has dropped by about 95% since the middle of April. There are currently 580 patients hospitalized for COVID-19 statewide, and 80 of those are in the ICU. The 3-day average number of patients in the hospital is down by about 85% since the middle of April. And as of yesterday, 6 hospitals are using surge capacity, but that's primarily related to non-ICU, non-COVID surge. We'll continue to monitor these metrics. It's pretty clear at this point that the Commonwealth has made significant progress to slow the spread of COVID-19 since March, gradually reopen our economy, and expand our testing capacity statewide. But that significant progress is due in large part to the cooperation and the participation of every resident. The Lieutenant Governor and I are incredibly grateful for the role that the people of Massachusetts have played in containing the virus. And this is no time to let down our guard. It's very clear from the research and the data that face coverings are the most important and significant way to stop the spread. And while there's been a lot of back and forth about what the virus is and what the virus isn't over the course of the last 120 days, the one thing we all know for sure is that it spreads from one person to another, and to another. The best and most important thing we can all do here in the Commonwealth is to continue to wear face coverings if you can't distance, to distance wherever you can, to be outdoors if you can be outdoors instead of indoors, to wash your hands and practice safe hygiene and disinfect surfaces. And if you're sick or you have symptoms, reach out to your provider. It's what telehealth is there for, and that's what our great provider community here in Massachusetts is there for. And stay home and get tested. The statewide average, as we all know, has hovered on a positive test basis at around 2% for the past couple of weeks. But obviously, we have seen, as we said last week, slightly higher averages in a number of communities around the Commonwealth where we also saw a drop in testing activity. So to encourage more testing in those communities, we launched a program to provide free testing in 8 communities that still see a higher average of positive tests and had seen a drop in testing. Free testing in these 8 communities started last Friday, and the Command Center will continue to monitor the results and expand to other communities if necessary. We all need to remain vigilant with respect to our activities here in Massachusetts so that we can continue to contain COVID-19. We all have a responsibility. You have been terrific in living up to yours, and we would just ask you to all continue to play by the rules, do the things that stop the spread, be willing to comply with the rules that have been developed by our Reopening Advisory Board, the general guidelines that have been put out by the Department of Public Health, and the other data and information that's available through your local communities. It's especially important as the rest of the country has experienced significant increases in recent weeks that we stay vigilant here in Massachusetts. We're also continuing to talk with our colleagues in local government and with our residents about what issues they face and how we can help them deal with the many other issues that exist in Massachusetts outside of COVID. On July 1st, we launched a $20 million fund for rental and mortgage assistance for low-income households. That $20 million fund was a mix of federal funding from the CARES Act and federal reserves. The money will invest in more access to emergency housing resources for families who need it. If you're a low-income household that's facing financial hardship related to COVID-19, please reach out to one of the 11 regional RAFT administering agencies. RAFT stands for Residential Assistance for Families in Transition. To one of those 11 agencies that administer this program to apply for help with your rent or your mortgage. The contact information can be found by visiting mass.gov/DHCD and clicking on COVID-19 updates. There's also $20 million in rental assistance and support currently in a supplemental that's before the legislature that we believe we're going to get sometime in the next couple of days. And in addition to that, today we're announcing that we'll begin distributing an additional $20 million on top of the other 220s in federal money that we've received through the CARES Act. That means in total, we will have approximately $80 million in CARES Act funding that we've put to work to support people with respect to housing. Today's $20 million investment will be distributed across 181 communities for food assistance, homelessness prevention, and for hard-hit small businesses through the Community Development Block Grant, or CDBG program. This funding is for non-entitlement communities as defined by HUD as municipalities with less than 50,000 people, and is an important part of how we're leveraging state and federal assets to meet this moment. The pandemic has caused communities to scale up and expand food assistance programs. We'll have more to say about this next week, including delivery options, which have been a critical part for many folks at risk. This new funding will also help micro enterprises, very small businesses that have 5 or less employees with up to $10,000 in grants. And some communities will be able to use this funding to provide job training for in-demand positions, especially in places like healthcare. The funding will help our communities support households who've lost employment, households who are struggling to access food, homebound seniors who are unable to get to the grocery store, and much, much more. We're pleased that in addition to the funding the state received, our 37 federally designated entitlement cities and towns in general communities that exceed 50,000 people in population that receive funding directly from HUD also received another $40 million. Those communities are using these resources in many of the same ways that today's funding will be used to support small businesses, community services, and people in need. We're also pleased to see many of our communities setting up additional emergency rental assistance programs that can supplement our RAFT and IRMA programs. DHCD is working with our partners at Mass Housing Partnership and at CHAPA to create great resources for communities who want to set up their own emergency rental assistance programs. The Department of Housing and Community Development has received $160 million in CARES Act funding across a variety of grant programs. They're distributing the funds across municipalities, shelter providers, community action agencies, and other service providers to meet the needs in various communities. And we're grateful to the Massachusetts delegation for securing these federal resources, and will continue to utilize them in the most appropriate way possible in conjunction with our colleagues in local government and the many nonprofits that are part of this community as well. All of this funding builds on many of the efforts that we've launched across our administration to support families during the pandemic. Additionally, we're encouraged by discussions with the legislature we've had relative to our Partnerships for Growth legislation that we filed originally in March and updated last month. That bill has more than $275 million in investments in it. It includes $85 million for housing efforts, including new climate-resilient, affordable housing and neighborhood stabilization in communities that were hit hard by COVID-19. And it also includes $50 million to support small and diverse businesses, especially those owned by minorities, women, veterans, and immigrants. This funding is an important step to support many of our communities. Now, since taking office, we've invested in several resources and worked collaboratively with the legislature to support more affordable housing, especially in the 2018 Housing Bond Bill, the largest that's ever been enacted that we signed. We've also filed a Housing Choice Bond Bill to make it possible for communities to build additional housing in their cities and towns. And we look forward to working with our colleagues in the legislature to expand housing and make it more affordable. Thanks.
Thank you, Governor. Good afternoon. The fight to combat COVID-19 has enhanced the need to address a number of critical issues in our Commonwealth, and one of which is housing. Before COVID-19, the combination of the increased demand for housing and the inadequate levels of production meant home costs and rental prices continued to climb over the last decade. With COVID-19, the impact of stable housing has never been clearer for individuals, for families, for households, for our communities, and on slowing the spread of this virus. In an effort to increase the production of housing and to expand access for families to have safe, affordable living spaces, we launched the Housing Choice Initiative in 2017. This program encourages our cities and towns to create more housing units through incentives, rewards, and technical assistance. The goal is to empower municipalities to plan and build the diverse housing stock our economy and our communities need. Communities recognized for their efforts to produce a significant amount of new housing earned the Housing Choice Community designation. This designation provides exclusive access to Housing Choice capital grants as well as other benefits. While current zoning continues to stymie housing production in many of our communities, these are the ones that are making strides and doing their part to help solve this crisis. Today, I'm proud to announce that 8 new communities have joined the list of Housing Choice communities. In total, we have 74 communities with these designations. This year's class of communities are as follows: Amesbury, Belchertown, Medfield, Middleborough, Newburyport, North Attleboro, Salem, and Sunderland. Thank you to the local officials and these communities for doing their part to increase housing units in our Commonwealth. Combined, the total of 74 cities and now towns have taken on a leading role in addressing the housing crisis, which now includes combating COVID-19. While we continue to progress toward our goal of creating housing that can meet the needs of our young people, seniors, and families of all socioeconomic backgrounds, this approach and the pending legislation we continue to advocate for supports our efforts to develop a statewide solution to a problem that affects our entire Commonwealth. Again, I want to thank this year's class of Housing Choice communities for their commitment to doing their part to address a long-standing statewide issue, and for their willingness to be leaders in our efforts to develop a solution that will have lasting and meaningful impacts. Thank you.
Questions?
Governor, do you support making masks mandatory as opposed to your order, which is temporary?
You mean doing something with a statute as opposed to through an order? I think the order is in place for masks whenever you're in public, because we believe that people wearing masks is the best and most appropriate way we can all work together to stop the spread. That order is going to remain in place until we don't have an emergency. If people want to engage in a discussion about masks as they relate to COVID, my view is masks are a fundamental part of how we contain and fight the virus. And we believe that the proposal we put in place, which gives locals the ability to also enforce this order with a variety of means and mechanisms that are available to them, has worked enormously effectively. If you look at Massachusetts relative to many other states in the country, our compliance with that mask order is very high. And again, I give the people of the Commonwealth credit for recognizing and understanding that this is not only an important way to protect themselves, but it's also an important way to protect others, given the amount of asymptomatic spread that exists with COVID generally.
Gloucester is having to close its beaches this weekend due to crowding. How concerned are you?
I don't think they're closing their beaches. Yeah, right.
To non-residents.
Yeah.
Excuse me. Due to crowding that they've seen over the last few weekends, how concerned are you about beach crowding as we head into a very hot week?
I think this is a great example of why we think it's important to create latitude and flexibility within the framework that we establish for cities and towns to do what they think makes the most sense for them. It's pretty clear that Mayor Taken in Gloucester and the City Council up there were particularly concerned about what they saw on, I think it was Good Harbor and Wingershik Beach last weekend, and they took action. And the action they took was to basically say that at least from this point forward, their beaches are going to be made available to residents. That's a perfectly reasonable and responsible decision to make in the context of the way we set this up in the first place. And it's our expectation that if other communities have issues that they believe they need to act on within the framework of the beachfront that they control, they should do so. It's part of the reason why on a number of occasions we've limited parking and a variety of other points of access to some of our assets, some of the Commonwealth's assets, when we've been asked to do so by local communities. Whether there'll be more or less is going to depend completely on the facts on the ground and some of the issues that are raised by our colleagues in local government and others. And that's, I believe, how it should be.
Is there a role for the state, though, in that, Sam Adams, we also read, shut down its tap room because of an influx of out-of-state visitors from hot spots, from states where there are spikes. So is there a bigger role? Should the state be doing more to limit instead of the suggested quarantine visitors?
Well, first of all, whatever any state does with respect to this has to be something that they believe they can actually implement. And we've spent a lot of time talking with our colleagues around the region about how the various approaches people have taken to quarantine have worked. And if we can find a better way to do this than the way we've done it before, we'll move on that. But there's the rhetoric associated with this, and then there's what people actually are doing. And in many cases, they're different.
Just out of curiosity, we talk obviously phase 3 is kind of where we're going to end until we get this vaccine. What is the state doing proactively to try to enhance the chances of getting the virus? We have so many, obviously, resources here. I was just wondering, is there something actually happening to proactively pursue a vaccine?
Well, there are a number of companies in Massachusetts that are very involved in a whole variety of things. We have people that are working on testing and screening programs. We have people that are working on treatments. We have people that are working on vaccines. Basically, our approach to that has been to make clear to them, and the Lieutenant Governor and I have personally visited a number of them, that if they have issues or concerns that they need our help with, or if they want us to advocate on behalf of what they're up to with federal agencies, all they have to do is ask. And and so there has been a lot of that kind of conversation back and forth. So far, for the most part, people feel they have access to what they need to actually pursue their potential solution. But at the same time, a number of these folks are working out of labs and joint ventures and innovation centers that were set up through funding, among other places, that came from the Life Sciences Center. So some of the places that are working pretty hard on some of this benefited from some of the investments that we made out of the Life Science Center to set up some of these acceleration and incubation labs over the last probably 10 years at this point. Yeah.
On the topic of housing, is there any more talks about extending the moratorium on the foreclosures?
Yeah, we've been talking just so people know, the current moratorium stays in place through the 18th of August. And we've been having regular conversations with our colleagues in local government, with folks in the housing community, with folks in the advocacy community, and folks in the legislature about this. And we recognize and understand that we're going to need to make a decision on that soon.
Last question. Governor, there were names of American groups outside the State House earlier calling to change, the state flag, the seal, and
Yep.
NASA's, problematic imagery. What do you have to say to that?
There's a conversation that's going on, in states and municipalities, and in some cases at the national level, about many symbols and historical emblems. And if people here in Massachusetts want to pursue discussions with respect to some of those, we'd be open to talking to them about it. Obviously, it's the sort of thing that would have to be done in conjunction with our colleagues in the legislature as well. But we'd be open to those conversations.
Any concern about the White House bypassing the CDC for the stats and stuff?
There are two issues going on right now with the White House and the CDC. One is the bypass. The other is a very significant increase in sort of daily reporting requirements. And I think many of us are concerned about both, okay? Because the big concern we have about the sudden increase in the number of elements that they're looking for is there wasn't much process to set this up or much dialogue or discussion about defining a lot of the things they're asking for so that they actually get what they're supposed to get and something that's not what they're actually looking for. So there's a process question and a data integrity question associated with that. The other issue is the CDC has been the sort of source of truth, for lack of a better word, around what's going on with regard to a lot of these issues for a long time. And I think many of us believe that that is, in fact, where that data should be gathered. We should be chasing data based on protocols and rules and definitions that have been part of the way the CDC's done this forever. And I think as this virus has continued to grow around the country, it's more important than ever that the CDC be able to produce what I would describe as a daily statement on truth with regard to hospitalizations, cases, ICU utilization, and all the rest. So I think a lot of us are very concerned about this and worry that it not only takes an actor who really understands their role and has been very good about making sure that everybody's playing with the same definitions in all 50 states across every institution so that the data is clean and clear and everybody can apply it appropriately. But in addition to that, sort of doing this bang, bang like this without a heck of a lot of process, when you're talking about this many moving parts and this many data elements and all the rest, sets us up for a situation where it's going to be very hard to understand what truth actually is as we try and figure out what's going on in New England and what's going on in the South and what's going on in the West, even just what's going on within the hospitals in our own state.
Governor, is there any update or what's the status of any contingency plans, any potential increase of restrictions that might need to happen if Massachusetts does see an uptick in cases again, or if there's any localized hotspots that continue to get worse?
I think the approach that we would take to that would be similar to the approach we took to it before, which is to isolate, test aggressively, and determine, in fact, whether or not you have a very small incident where you need to isolate, trace, and help people. That sucker's loud. And help people with whatever the situation and the circumstance is, or something bigger. But that's been, remember, folks, COVID's been around here for quite a while. It's going to be around here for quite a while. We've had, businesses that have shut down for a few days. We've had branch offices shut down. We've had a lot of experience at this point. We've done, rapid testing in places where we saw an outbreak. I think those kinds of things are the kinds of things you're going to continue to see happen depending upon where we see it. Part of the reason for expanding our testing regimen in 8 places to start was to make sure that we were making testing available in places where we had seen relatively high positive test percentages and a big drop in testing in those communities. We want to see what's going on there and enhance the level of testing that's there. And we'll continue to move that kind of program around if we think it's appropriate and necessary and act accordingly. At this point in time, remember, I think these numbers aren't exact, but the contact tracing program between the collaborative and the local boards of health has taken over 130, has had over 130,000 people who they needed to connect with, and have connected with north of like 115 or 120,000 of them. The numbers, there's a lot of work that's going on every day in Massachusetts to identify and reach out to and connect with people who test positive and their close contacts. And that work, in some ways, is as good a bellwether as any with respect to what's going on, in addition to some of the other things we're doing with our testing program generally.
Governor,
you had
Safe
said
Communities
last
Act
week-
has
Governor, you had
advanced
said
out
last
of.
You guys are both talking at the same time?
You had said last week that the state was always looking to secure more PPE.
Yeah.
How is our PPE supply right now? Fall's not too far away.
Yeah. Our PPE supply, our personal protective equipment supply is in good shape, but as I've said before, we are always looking to purchase and acquire PPE. And I think the other thing I said was that,
What do you mean good shape, though? What does that mean?
well, remember, we have history here. One of the best parts about having history is you can use it to sort of map out what you think your requirements are going to be going forward, particularly if you're going to need to deal with something that was similar to the situation we dealt with a couple of months ago when we were really in the midst of all this. So, you know, we have what I would call just sort of a running tally of what our historical needs were based on certain levels of positive test results, hospitalizations, and all the rest. And we know what that looks like if we sort of turn it around and point it forward and know how much we need to have of various kinds of supplies to support nursing homes and hospitals and our own 24/7 programs and first responders and social workers and all the rest.
The Safe Communities Act has advanced out of the committee. Has your position on that changed?
No. Thanks, everybody.